right, good afternoon, everyone. I'm Reyna Taylor, the Vice President of Public Policy with the National Council for Behavioral Health. Thank you all for joining us today as we discuss the progress towards creating a new suicide prevention hotline. We're honored to be joined by Federal Communications Commission Chairman Ajit Pai, Senator Cory Gardner from Colorado, Olivia Hussey from Representative Seth Moulton's office, Dr. David Carroll, Executive Director of the Office of Mental Health and Suicide Prevention at the Department of Veterans Affairs, Dr. Elinore McCance-Katz, Assistant Secretary for Mental Health and Substance Use Disorder with the Department of Mental Health and Human Services, Substance Abuse and Mental Health Services Administration, David Guth, CEO of Centerstone and Executive Committee Member for the National Alliance for Suicide Prevention, and Sam Brinton, Head of Advocacy and Government Affairs at the Trevor Project. As the rate of suicide continues to rise in America, it's more important than ever that a person experiencing a mental health crisis can reach someone quickly and easily. Once Chairman Pai and the FCC complete their work, a new 988 suicide prevention hotline will replace the current 10-digit number. Because failure to remember a phone number shouldn't be the difference between getting help and losing a life. Our hope is that this new hotline will serve as a lifeline to those in need. With that, I'd like to introduce Chairman Pai.
Thank you so much, Ms. Taylor, for the introduction, and thanks to all of you for being here today. When I was growing up, suicide was generally considered a taboo topic in our country. It was a topic that was rarely discussed, and many embraced the view that talking about suicide would encourage it. We understand today, of course, that the opposite is true. By speaking openly about suicide, we reduce the stigma surrounding the subject, and we make it easier for people to talk about their struggles and to seek the help that they need. Many organizations represented here today have played an important role in bringing the issue of suicide out into the open, and I'm personally grateful to them for the work. In particular, thank you to the National Council for Behavioral Health for hosting us and for the critical work that you do. Thank you to the representatives from the Departments of Veterans Affairs and Health and Human Services who are with us, reinforcing that combating suicide is a government-wide priority. Special thanks to my friend, Senator Cory Gardner, for his leadership on this issue, and I would also like to salute those members of Congress who could not be with us here this afternoon, in particular, Senator Tammy Baldwin and Representatives Chris Stewart and Seth Moulton. This issue enjoys strong bipartisan support on Capitol Hill, and I'm hopeful and confident that we will see similar collaboration at the FCC. And thank you to our many other distinguished guests, including Centerstone CEO David Guth, and my fellow Kansans, Sam Brinton of the Trevor Project, as well as representatives of LGBT Tech who are here with us. Before I get to my announcement, I think it is important to lay out a few facts. Fact one, suicide and mental health disorders are on the rise in America and have reached historic levels. Suicide rates in the United States are at their highest levels since World War II. In 2017, more than 47,000 Americans died by suicide. That represents a 33% increase just since 1999. And more than 1.4 million adults attempted suicide. This crisis is disproportionately affecting at-risk populations. More than 20 veterans die by suicide every day. Between 2008 and 2016, there were more than 6,000 veteran suicides each year. Perhaps the most disturbing trends involve young people. More than 1 in 10 young adults report having suicidal thoughts, a 47% increase since 2009. Suicide is the second leading cause of death on college campuses, and LGBTQ youth contemplate suicide at a rate almost 3 times higher than heterosexual youth. More than 500,000 LGBTQ youth will attempt suicide this year alone. And that leads me to fact 2. Suicide is preventable. Suicidal thoughts don't inevitably lead to suicide. Help is available, and it can be effective. When people get assistance, they are less likely to die by suicide. In one review, for instance, 500 suicidal individuals who reached out to Lifeline crisis centers were surveyed, and 95% of them reported that the call helped stop them from killing themselves. Nearly 80% of those same callers said that follow-up contacts 6 to 12 weeks later had a positive impact, giving them hope and making them feel cared about. Which leads to fact 3. When we make it easier for people in need to seek help, many will do so. Here's just one example. In 2017, the rapper Logic released a song about suicide. It had an unusual title to many, but one familiar, I suspect, to people in this room: 1-800-273-8255. For those who don't know, that is the number for the National Suicide Prevention Lifeline. The song struck a chord with audiences and has been streamed over 1.5 billion times now over various platforms. And more important, in the 3 weeks following the song's release, there was a 27% increase in the number of calls to the National Suicide Prevention Lifeline. So just think about that. If one pop song can significantly move the needle, just imagine how many more people could get the help that they need and deserve if there were an easy-to-remember 3-digit number for emergency suicide prevention and mental health services. There could be, there should be, and I'm here to announce that, should I get the support of a majority of my FCC colleagues, there will be. Today, I'm proposing that the FCC move forward with the necessary steps to establish 988 as a national 3-digit number to access suicide prevention and mental health services. Under my proposal, anyone calling 988 would be routed to the established National Suicide Prevention Lifeline, which is already sharing lives. I shared this proposal with my FCC colleagues earlier today, and we will vote on it at our December 12th meeting. I would like to thank members of the FCC staff, many of whom are here today, for their hard work, dedication, and personal commitment to this important issue. Based on our staff's careful analysis, I believe that we can get 988 up and running more quickly than other 3-digit numbers. And quicker access will mean more lives saved. In addition, 988 has an echo of the 911 number we all know as an emergency number. Awareness of this resource, including how memorable the number is, should make a real difference when those in dire straits want to reach for a lifeline. Of course, an increase in calls will mean increased demand for crisis centers, which will require, in turn, increased resources. And that is why it is so important that this has the support of members of Congress from both parties and in both chambers, representatives from the federal agencies, and nonprofit organizations that provide counseling services. We all recognize that the FCC's proposal needs to be part of a broader effort. And today's event, my colleagues here, demonstrate that we have a coalition willing and able to improve America's mental health support network. Establishing 988 as a hotline for suicide prevention and mental health services would help so many people. At this very moment, there are Americans all across this country who are struggling. They are searching for answers, they are searching for hope, they are searching for connection. And to them I say, you are not alone. The FCC is committed to helping. The people in this room are committed to helping. A simple number, 988, could be the lifeline that makes all the difference. Working together, we can make this happen, and working together, we can and we will save lives. Thank you all once again for being here. It is now my privilege to introduce the Senator from Colorado, Mr. Cory Gardner.
Thank you, Chairman, on this phenomenal news, and thanks to so many of the great people in this room and standing before you today for your tireless advocacy and work for years. To my colleague, Senator Baldwin, who could not be here today, thank you for your work. To Congressman Moulton and Stewart, thank you very much for their championship of this legislation in the House. And to Chairman Pai, thank you for that news as we move forward to make this a reality. My first meeting this morning in the office was at 7 o'clock. In 1 hour, we will lose a Coloradan to suicide. Because in Colorado, we have a Coloradan die every 7 hours by suicide. As a father of 3 young children, it breaks my heart to think that we continue to lead in Colorado in so many areas. The number of days of sun in our great state, the number of ski resorts, but also the number of youth that we lose every year. 58% increase in death by suicide over the last 3 years alone amongst our teens. When somebody's suffering from a heart attack, we know exactly what to call, where to call, who to call. From the youngest of children who can pick up a phone, they know that you dial 911. It's emblazoned in our minds, 911, it's who we call. But when our parents, when our friends, when our neighbors when ourselves need help for something other than that health crisis, that heart attack? Who do we call for that mental health need? Do you remember a 10-digit hotline? I can remember having panic attacks about being able to call our local police department in a time of need. To be able to remember 988, to have that number right beside 911, who to call, is so critically important. To have that impact, to have that ability, to have that number to save lives. To solve this problem, that 3-digit number will save lives. It's a bipartisan idea that time has come that's taken too long. I'm embarrassed to say that it's taken this long to get this job done. The line will allow veterans to press 1 for specialized support and counseling. The work that it will do to reach out to LGBTQ communities in our country, to save lives, to make an impact, to give people hope, to give people help. It was about 6 months ago in Grand Junction, Colorado, when I attended a boxing match. And the community underneath this big tent in the middle of summer had a big ring in the middle of this tent. And it was about mental health awareness. And it was the community coming together to talk about their fight to destigmatize the needs around mental health, the discussion that we have to have around suicide. And in the heartwarming stories that every single person went into the ring to share, they talked about what could be done to help save our communities, to put an end to the cycle, to help save Coloradans, Kansas, and so many other people around this great country who just need a chance, a hope, a lifeline to reach out to. And that's exactly what 988 will do. That lifeline to continue our work, your work. So many people and advocates in this room have done to save lives. It's one more tool for us that we can bring together, not because someone's Republican or Democrat, not because someone leans left or right, because we all have family members and friends and communities in need. Be proud of the work that you've done, because this will make a huge impact. Thanks to all of you for the successes you've had to this day. Thanks to the chairman and others who have been here. This is a reality because of your work. Thank you.
Well, thank you so much, Senator, for those thoughtful remarks. I'm now privileged to introduce, from the office of Congressman Seth Moulton, Ms. Olivia Hussey for her remarks.
Thank you. I'm Olivia. I'm with the office of Congressman Seth Moulton. Seth is so sorry that he can't be here today. He is voting right now on a CR to fund the government, so couldn't miss that one. But I'm happy to be here to deliver his message instead. And thank you so much to Chairman Pai for including us in this event. Like I said, he's deeply disappointed to miss this, as this is an issue that is deeply important to him and personal to him as well. Alarmingly, suicide rates have increased in the past 2 decades. It is now the second leading cause of death for young Americans and disproportionately impacts the LGBTQ population. And roughly 20 American veterans die by suicide each day. These aren't just statistics. These are real people who leave behind shattered families and grieving communities. They are our friends, they are our colleagues, and they are our loved ones. And we are losing too many of them. It's time to treat suicide like any other life-threatening emergency. And that starts with making it easier to get help. Like Senator Gardner said, when your house is burning down, you don't have to look up the number for your local fire station. You dial 911, and you know that. Let's make it that easy to react in a mental health crisis by designating 988 as a national number for mental health emergencies. Seth wants to thank the FCC for its work to support the designation of a 3-digit mental health hotline. The Commission's timely report was critical and important to the National Suicide Hotline Designation Act, a bill that my boss and Rep. Chris Stewart introduced this year. As of today, the bill has
106 bipartisan co-sponsors in the House, and that's a lot of momentum and support on both sides of the aisle to get anything done. So we're very excited about that. On behalf of Seth, I'd like to thank you all once again for your support of this common sense, life-saving initiative. He appreciates your work and looks forward to moving this idea ahead in the coming days. Thank you very much.
Thank you so much, Ms. Hussey, to you and to the Congressman for your leadership on this issue. We will now hear from one of our federal partners, Dr. David Carroll, from the Veterans Affairs Office of Mental Health and Suicide Prevention.
Thank you, Chairman Pai, and thank you, Senator, and to all of our congressional partners and to our federal partners across the space, and to all of you, our partners in the community who are dedicated to this effort to change the tide of suicide in America for all Americans, and for the Department of Veterans Affairs, particularly for us, for veterans and their family members. This is absolutely our #1 priority within VA. To prevent veteran suicide, to work with veterans and their families. And we are very grateful to the FCC and to Congress and to everyone else who has worked on this national 988 proposal. We've been happy to be part of that up until this point. It's a terrific opportunity. It's a terrific opportunity to provide ease of access, and as several speakers have said, clarity during that moment of crisis so someone can easily reach out and get help. And we look forward to the opportunities that this presents for itself. As Chairman Pai said, we expect that this ease of access will actually increase the number of citizens requesting help, and that's a good thing. And certainly VA, through our Veterans Crisis Line, we want to be able to be ready to address that, but we see the opportunities that this may present to develop a wider continuum of services across the country for mental health and suicide prevention services. The Veterans Crisis Line right now typically answers on the average of 18 to 1,900 calls a day, may dispatch emergency rescues up to 90 or 100 times a day, and then refers several hundred veterans into care on a daily basis. And this is an opportunity to extend that through the Press 1 function, which the Senator mentioned, to continue that care. But other things that we offer through the Veterans Crisis Line is a chat and text function, and that may then become a national opportunity for us working together through the 988 system. In the meantime, the Veterans Crisis Line and all of us in VA are going to continue the work that we're doing through the current 800 number, working with our SAMHSA colleagues, 800-273-8255, and then press 1 for the Veterans Crisis Line. We look forward to this opportunity to move together and are ready to help and participate in every way that we can. Thank you.
Thank you so much, Dr. Carroll, for those remarks. We will now hear from another distinguished federal partner, Dr. Elinore McCance-Katz, who serves as the First Assistant Secretary for Mental Health and Substance Use, and she also leads the Substance Abuse and Mental Health Services Administration. Doctor, thanks so much.
So I'm very pleased to have the opportunity to speak for just a couple of minutes about the work that the Substance Abuse and Mental Health Services Administration, SAMHSA, has done in partnership with the Veterans Affairs and also with the FCC. SAMHSA is the lead federal agency charged with addressing issues related to mental health and substance use across the nation. As such, suicide prevention is a top priority for us, and today marks an exciting time in that effort. We now look at the possibility of a 3-digit number for suicide prevention, 988, and we very much look forward to the implementation of that as soon as possible. I believe that adoption of this number will make it easier for Americans to reach out for help during a time of great need for themselves or a loved one. Having to remember what 800 number to call, and we have 2 of them at SAMHSA, if they or a loved one are thinking about suicide or experiencing severe emotional distress, can be yet another stressor and might keep them from reaching out. Just as a person experiencing a medical emergency or their loved one is likely to remember that 911 is the number to call, we hope that any American in a mental health crisis or who might be considering suicide will come to know that 988 is the number to call for immediate assistance. Because of the three-digit number, we anticipate that many more Americans will call the National Suicide Prevention Lifeline, which is based at the Substance Abuse and Mental Health Services Administration. We believe that more lives will be saved as a result, and we know that the need for this resource is great. Suicide is now one of the 10 leading causes of death in Americans. The National Suicide Prevention Lifeline is a network of over 165 crisis centers across the United States that provide crisis intervention around the clock every day of the year. In 2018, Lifeline crisis centers answered over 2.2 million calls. The Lifeline's crisis centers are in many ways the nation's mental health safety net, and the adoption of the 988 number will make it easier to reach these centers. The 988 number will also make it easier for veterans, service members, and their families to reach the Lifeline and to press 1 for the Veterans Crisis Line. Whether the need is for meaningful contact with a crisis counselor who can assess their suicide risk, referral to a mental health service, substance use disorder treatment, or other needed services, or for emergency intervention, calling the National Suicide Prevention Lifeline through 988 will help to meet that need. However, for the promise of the 988 number to be fully realized, it will be essential that there be enhanced capacity for the crisis centers who answer the calls. If a caller is in a suicidal crisis, every minute can be critical, and it is vital that each caller be connected rapidly. Only if every call can be answered promptly and effectively with follow-up and linkage to needed mental health care and other services will that critical role that 988 can play in reducing suicide in the United States be fully realized. SAMHSA looks forward to continuing to partner with all of the local crisis centers who participate in the National Suicide Prevention Lifeline, and we very much thank them and appreciate their efforts, as well as with our colleagues in the Veterans Administration and with the FCC to achieve this vision to reduce suicide in America. Thank you very much.
Thanks very much, Doctor. We will now hear from Mr. David Guth, who is the CEO and co-founder of Centerstone. Thank you.
Well, first of all, I want to say at this historic moment in time when we are heralding in a new era in fighting this just devastating epidemic, there's so many people to thank for the efforts thus far. And first of all, Chairman Pai, thank you so much for the FCC and the wonderful leadership in this area. I also want to thank Chuck and Golia and the National Council for not just hosting us here today, but for their tireless work in this area for many, many years. I want to thank the Senator Gardner. Thank you so much for your leadership on this, and your colleague, Senator Baldwin, Congressman Moulton and Stewart. Really appreciate their leadership in championing this. We've got a couple of national heroes in the audience here today that have been internationally impactful in fighting the epidemic. David Covington and Dr. John Draper are here, and I just want to thank them personally for their work in this effort. There's so many others. Our Action Alliance, National Action Alliance for Suicide Prevention. This has taken a true village to get us to this place in time, and we have a long way to go in order to secure the funding. But there is no doubt that countless lives are going to be saved. I know that in this room alone, suicide in one way or another has touched the lives of every person here. Certainly it's touched my life. To know that we are extending this very important lifeline for generations to come is enormously important. So thank you again, Senator, Chairman, thank you all so much for your incredible championship for this important time and place. Thank you.
Thank you very much, Mr. Guth, for your remarks and for your advocacy. Last but certainly not least, we will hear from Mr. Sam Brinton. I had the privilege of meeting with Sam and other colleagues from the Trevor Project several months ago, and those discussions very much informed my thinking about this issue. Sam, the floor is yours.
Absolutely. Thanks so much. Let's do this. Good afternoon, everyone. My name is Sam Brinton, and I use they and them as my pronouns. I serve as the head of Advocacy and Government Affairs for the Trevor Project, the nation's largest LGBTQ youth suicide prevention organization. First and foremost, thank you to the FCC and Chairman Pai for including the Trevor Project in this important discussion, and of course, to NCBH for hosting us. On behalf of the more than 110,000 LGBTQ youth whom we serve every month, I want to thank the FCC for championing the transition of the National Suicide Prevention Lifeline to a 3-digit dialing code 988. Under the leadership of Chairman Pai, his team, and the amazing Wireline Competition Bureau, we are now closer than ever to the monumental shift in combating the national suicide epidemic and saving more lives. Critically important to our community, the FCC's August report to Congress identified young LGBTQ Americans as an acutely high-risk population for suicide attempts, and also recognized the specialized services for such at-risk populations. The Trevor Project stands ready to help the NSPL serve the population, and today urges the federal officials to do 3 things. Yes, you heard about the 3-digit code. We have 3 action items. I'm a Kansas State University grad. We always have homework. 1, we need to act quickly in implementing 988. The longer we wait, the more lives are at risk. 2, we need to make sure that the amazing counselors at NSPL are provided LGBTQ cultural competency training for everyone. And 3, last but not least, we need to establish an integrated voice response to route calls to organizations with the appropriate specialized services to assist LGBTQ youth in crisis, like the Trevor Project. These specialized services work. As you heard from the Veterans Crisis Line, Dial 1 saves lives. A recent study by the USC found that over 90% of youth in crisis who use the Trevor Project resources were successfully moved out of a state of crisis. And given that LGBTQ youth are 4 times more likely to seriously contemplate suicide than heterosexual youth, we must work with the FCC, the Substance Abuse and Mental Health Services Administration, and the U.S. Congress to ensure LGBTQ youth are provided these necessary resources as the 988 implementation phase moves forward. Together, we can build upon this enormous achievement and create a better future for all of those in crisis. Thank you again.
So at this time, we'll be taking a few questions. Before we do that, however, since Sam very generously opened the door, I would like to recognize the enormous efforts of the FCC staff. If those of you who are on our team wouldn't mind standing up to be recognized, these are the foot soldiers in helping make this number a reality for millions of people, and I really want to make sure they get their time in the sun.
Chairman Pai, Matt Danman, Communications Daily. Assuming the FCC approves the proposed rulemaking at the December meeting, we've got a public comment period. Do you have a calendar timeframe by which you hope in 2020, 2021 that this is finalized? When do you expect this? Assuming this all goes forward, how soon do you expect this to happen?
Certainly, as
with formal designation.
As with any notice of proposed rulemaking, we intend for this to be the Kickstarter for a public conversation, and we want to get meaningful input from the public on all aspects of the 988 issue. And as you'll see when we release publicly the notice of proposed rulemaking in short order, we tee up a whole bunch of different questions that we want input on. I can't obviously forecast what specific time frame within which we'd be able to assess that input and reach a decision. But what I can tell you is, and you could probably deduce this from my remarks, this is a very important issue to the SEC. It's a personal priority for me, and we recognize that we need to move with dispatch in order to provide assistance to our fellow Americans in need. So we'll be moving as quickly as we possibly can to reach a report and order stage soon.
Hi. Caitlin from Colorado Public Radio. So if you move forward with this, or if the FCC moves forward with this, will you need congressional approval, or Congress now, the bill won't have to go forward in Senator Gardner, Representative Moulton's office, if you guys have comment on that? I just want to, just sort of the logistics of it.
So certainly would defer to the legislative representatives for what they are doing on the legislative side. From our perspective, at least, this is a follow-on from a congressional act that was passed last year that asked us to issue a staff report analyzing the feasibility of a 3-digit national number for mental health and suicide prevention. And as a result of that report, I studied it very carefully, and I thought the right thing to do was to go even further and to actually kickstart the notice of proposed rulemaking, ultimately leading to a report and order. So we do have the authority, we believe, within the existing framework of the Communications Act to move ahead. But again, I would defer to our colleagues from the legislative branch on any additional authority they would wish to give us or to our sister agencies.
And thank you, Caitlin. And we believe this is part and parcel of the effort to make this a reality, 988, to make this a reality, that we continue to partnership with the FCC and the organizations in this room to make this a reality. So whether it's issues of how this will function, what we can do to help make sure that we have the personnel resources necessary for training, getting more people into the specialty services that they will need to be trained to address the calls, legislation that we will continue to address with funding and other issues. So these really are a part and parcel of the same effort to make this a reality. So I'm just grateful for the FCC and the work the chairman has identified, also the work of my colleagues in Congress to continue this to make it a reality.
And the only other thing that I will add is that the bill that my boss and Rep. Stewart and Senator Gardner and Senator Baldwin have, they include a designation, which is critical for Congress to be involved, as Senator Gardner said. But it also includes a fee-for-service aspect as well, which is a funding mechanism that would provide more funding for the local call centers to receive more funding so they can have the resources they need to pick up those phones. And as the FCC would need the congressional authority to do that.
Hi, Chairman. I was wondering if you could give us some information about the technical or back-end changes that carriers and the FCC might have to make in order for this hotline to be a reality.
These details will be in the item which will be publicly released soon, but I can tell you, having reviewed the notice of proposed rulemaking carefully, that we look at various aspects of network configuration involving the switches, the legacy switches and the IP-based switches that would have to be tweaked or replaced, any aspect of the network that might impact the ability to transmit a 988 call to the National Suicide Prevention Lifeline. And so we want to take a very holistic view because we recognize that any call that is dropped or that is impeded is a call that won't be answered by someone who can provide help. So we tee up every aspect of network configuration.
Thank you all for your time today and for the very thoughtful questions that were asked. We appreciate you coming out today and spending this half an hour, 45 minutes with us. So this concludes our press conference. If there's anything else that you would like to follow up with, please visit some of the staff that are here. Thank you.